Hello everybody, my name is Paige. I am Mrs. Zumbrin's daughter. I'm a third-year pharmacy student at the University of Tennessee. I'm by no means an expert on these topics, but Mom asked me to give a couple quick tips and pointers and just things from my experience working in the pharmacy and as a pharmacy student. So I'm going to go over some treatment for musculoskeletal disorders. Really, these disorders can be managed with a variety of treatment options, but this generally does include one or two medications to treat the pain or inflammation that's at the root of the problem. Pain medications are some of the most highly dispensed medications in the U.S. I see these on a daily basis, multiple times a day, along with antibiotics, blood pressure medications, cholesterol medications, diabetes medications, things like that. So it's important to look at the patient as a whole when you're looking at what could be helpful for their pain. It's very important to think about drug-drug interactions, and then we want the patient to be taking the lowest dose with the least amount of side effects. We want it to cost little for the patient. So all these things are factors when going into what can treat their pain. A lot of the medications for these disorders are over-the-counter medications, but they can need something more, such as opioids, if it becomes more of a severe chronic issue. Tylenol is the over-the-counter medication that you probably see most often. It's commonly recommended for mild to moderate pain, but the problem with that one is it can cause hepatotoxicity, so liver toxicity, if it's taken at maximum doses for a chronic amount of time. Typically, it's not recommended to take more than 4 grams of Tylenol a day. Some NSAIDs, or non-steroidal anti-inflammatory agents, are ibuprofen and naproxen. They're commonly recommended for general muscle aches, arthritis, and tendonitis. Although they're helpful for pain, they do have their own side effects as well. They do cause GI ulcers, GI bleeds. So it's important, especially if you have a patient on anticoagulation therapy such as warfarin, to really monitor any signs and symptoms of bleeding with these medications, because although they're effective for inflammation and pain, they also have that bleed risk as well. A new over-the-counter option for arthritis pain is a gel. It's called Voltaren or diclofenac. It has recently gone over the counter, so it's a new option for patients who need some management for their arthritis pain. The benefits to the gel is that it's applied directly to the site where they need the pain management, and instead of having to wait to take a pill and wait for it to go systemic into the body, it can be absorbed immediately and it has more of a direct action. It's also pretty inexpensive. You can get a smaller tube for like $13, a larger tube for $30. So depending on how long you think you need it, that's a pretty cheap option for quick management. On the flip side, for more severe cases, opioid therapy may be necessary if people's pain cannot be controlled by the previous agents that we've discussed. Although effective, opioids should really be the last line due to their abuse potential, as you've probably heard of. We're really in the midst of an opioid crisis, so it's definitely well known that there's a high abuse potential there, as well as adverse side effects. It can cause severe respiratory depression, slowed heart rate, so those are really side effects that are pretty major, and they definitely need to be monitored. Chronic opioid users really should be monitored regularly. Their vitals should be checked regularly if patients are taking opioids or multiple pain medications while in the hospital or even at home. And due to state and federal laws, patients really can't get refills on medications without seeing their doctor and being prescribed these on a monthly basis and being monitored because of all of the severe abuse potential and adverse side effects that occur as well. Most commonly recognized opioids are hydrocodone and oxycodone. This is what I see dispensed most often. They're generally formulated in a combination with Tylenol. So these pills are referred to as Norco or Percocet. Those are the common brand names that you'll hear. Some other opioid formulations that you may hear of, fentanyl patches are pretty common for chronic pain patients. IV medications such as morphine and hydromorphone are commonly used in the hospital for post-op pain and for other pain related to hospital diseases. In addition to the respiratory depression, opioids can cause constipation, nausea and vomiting, just general discomfort to the patient, and prolonged use of opioids in pregnant women can lead to neonatal withdrawal. So there's really a lot of adverse side effects on top of the abuse potential that make these drugs really not first line for your patients. And although they're highly effective, they really should only be taken if absolutely necessary. Unfortunately, our country has a problem with this right now. Opioids have been overprescribed and people have become addicted to them. It's led to doctor shopping, pharmacy shopping, and unfortunately is a problem that we're dealing with as a nation right now. So just be aware of that. Be aware of the signs of opioid overdose, such as the respiratory depression, the slowed heart rate, looking cyanotic, things like that. That's just really should be in the back of your mind if you have a patient you see that's on pretty high doses of opioid pain medications. And then it's also important just to mention to patients if they're taking them to always keep them out of reach of pets or children. They are very dangerous for small animals, small children. And then just to always have proper disposal if anyone has expired medications or if they no longer think they need those medications, just to ensure that they know they can take those to the police department or somewhere that can dispose of them properly for them. So although effective drugs, just keep in mind those, if you see those on someone's chart, pay extra attention to those, as clearly they do cause side effects and things like that. So that's just a quick overview of some pain medications that I've dealt with and that I think would apply to you guys. So if you have any questions, my mom can give you my contact information. Again, my name was Paige. Thanks for letting me talk to you guys. Hope you have a good rest of your semester.